Hello, I'm Jack Grillo. I'm a member at Genesis Club in Worcester, Massachusetts. I have been in the Clubhouse world for over 20 years and have been engaged in just about every aspect of Clubhouse, including Clubhouse International Faculty Training in April 2004 at Fountain House in New York, and I'm scheduled to perform my 20th accreditation visit this November. 2005, I started my supported employment position at UMass Medical School, Psychiatry Department's Center for Mental Health Services Research, and I celebrated my 8th year this month. I chair the Consumer Advisory Council called Mental Health Experience and Years of Understanding, or Me and You Advisory Council, for the Center for Mental Health Services Research at UMass Medical School. Although this is not officially a Clubhouse activity, I wanted to share this with my good friends in the Clubhouse world. As part of my job at CMHSR, I get involved in projects that allow me to work with the members, staff, and visiting colleagues from Genesis Club, along with peers from other local programs, and the Stigma Fighting Campaign is an example of a successful collaboration. This was now the first of an annual Me and You campaign to observe May as Mental Health Awareness Month. The Stigma Fighting Campaign started as a means of utilizing the Me and You Facebook and Twitter accounts that I started in 2011. This gave us a forum to disseminate research findings and discuss ideas about the direction of mental health services research at CMHSR. But I needed a way to attract followers. May was a couple of months away, and I wanted to observe Mental Health Awareness Month somehow. Why did we choose the topic of stigma? One common experience of most mental health consumers is discrimination by stigma, that imposed by other people and organizations, as well as self-imposed stigma. We posted daily stigma fighting statements, just words, during May 2011. The idea of video recording the statements was brought up when I got my first smartphone in time for May 2012. We produced and posted 36 stigma fighting video statements, each of which is based on research. There is a reference to the original research provided with each statement. Halfway through the month, I realized that these videos could be used as public service announcements. In August, UMass Medical School allowed us to broadcast them over TV and radio. Since August 2012, WCCA TV 13, a local cable access channel in Worcester, Massachusetts, has been airing our videos. We are working on distributing them to other stations, and you can find them on our Facebook, Twitter, YouTube, and archive.org internet sites. And here are a couple examples.
Good afternoon. My name is Kevin Bradley, and I have the honor of being the Executive Director of the Genesis Club in Worcester, Massachusetts. Today's mental health stigma fighting statement is: adults living with serious mental illness die 25 years earlier than other Americans, largely due to treatable medical conditions. For more information about this statement and the UMass Me and You Advisory Council, please visit us on Facebook at Me and You Community.
Hi, I'm Jack Grillo. I chair the Me and You Advisory Council here at the Center for Mental Health Services Research at UMass Medical School. Today's mental health stigma fighting statement is: a recently published study found that the likelihood of depression was significantly higher for men and women who reported previous diagnosis of sleep apnea. Additionally, the likelihood of depression also increased with frequency of snorting and stop breathing. Our current stats show that we have outreached to 6 continents, 36 countries, and 35 states, totaling 8,630 hits. The outreach statistics presented here are combined data from youtube.com, archive.org, Facebook page called Me and You Community, and Facebook group called Me and You Advisory Council Group. These websites accumulate their statistics differently, so for the purpose of this comparison, downloads, views, and scenes all equate to hits for the content accessed. I uploaded the stigma fighting video statements to archive.org in August 2012 and received nominal amount of downloads during the year, but recently checked the site in July and August, and the number of downloads doubled and tripled, getting up to triple-digit amounts. I thought that I would have a stigma fighting campaign annually, but we decided to vary themes. This year we ran a wellness campaign and produced 32 wellness statements. A proposed theme for 2014 is how to give and get peer support. I am happy to have started the tradition of observing May as Mental Health Awareness Month by way of a video campaign here at Center for Mental Health Services Research at UMass Medical School. Thank you very much for your time, and here's one more example. Thank you.
My name is John Forhart, and I'm a proud member of the Genesis Club on Lincoln Street, and I happen to work in the coffee shop. It's a great place to be. Today's mental health stigma fighting statement is: people with mental illness can and do recover. If you need any other information about this statement, you can call UMass MH&E and U Advisory Council. Please visit us on Facebook at MHEYOU Community. Have a wonderful day and a happy Mental Health Month.